All right, so there's very few things in the eye world that are truly emergencies. This is one that just might be. It's called Bell's palsy. Let me tell you what it is and how it affects your eyes. All right, so imagine you wake up or you're going about your day and you notice that one side of your face starts to go kind of weak. Your lid starts to droop. You can't smile on one side of your face. What are you thinking? Stroke, right? Make sure you get to the ER as soon as you can, get checked out. Once you get there, if your doctor says, if the emergency room doctor says it's not a stroke, you have something called Bell's palsy, the next call needs to be your eye doctor. Yes, your eye doctor for something happening to your face. Now let me explain what's going on with Bell's palsy. It's a paralysis of the facial nerve. When that nerve is inflamed or it's thought to possibly be a viral infection, everything goes weak on one side. This is very similar to what happens when you have a stroke. That's why it's so scary and nerve-wracking. When you look at a person that has Bell's palsy, one side of their face is completely just paralyzed, the other side will work like normal. Now, in the case of your eyes, this can be incredibly problematic because you can't blink, you can't close that lid. At that point, your cornea is exposed to the environments, and this can lead to scarring and even blindness if you don't treat it. The elements aren't kind to your eyes, and if they dry out, that's a bad thing. So let me tell you what my normal treatment is for a patient that comes in with Bell's palsy. Over the years, I've seen numerous Bell's palsy patients. Never once have they come into my office first. If they did, I send them to the ER because I, like everyone else, wants to make sure they're not having a stroke. Now, when they do come into my office, they're usually already on an antiviral. If they're not, I'm gonna make sure they get on one. This can help speed recovery. Now, my main focus is your eye, okay? When you can't close your eye, it can lead to dehydration, it can lead to scarring, it can lead to infection. So number one, I'm gonna see what kind of movement, what kind of lid function that you have. Some patients will have more than others, but usually in those first 2 days, it's non-existent. So we're gonna put you on a preservative-free artificial tear, okay? You use that as much as you possibly can. I will also prescribe an ointment. Now, ointments are great because they're gonna lubricate the eye like crazy, but they make your vision blurry. I tell patients you're gonna have to deal with the blur because even if you use that preservative-free artificial teardrop, it's not enough throughout the entire day. The gel will sit there on your eye and keep it moist and stop it from becoming infected. Now, I'm also going to give you an antibiotic. The antibiotic fights the infection. The gel is going to keep the cornea from becoming compromised and exposed to the environment. So they're working together to prevent infection and keep that natural barrier of the cornea protecting your eyes. The next thing is, we want to find something we can do to protect your eyes when you go to sleep. When your eye is exposed and you're rolling on your pillow, that can cause an abrasion. It can get a lot of debris in your eye. That can be incredibly problematic and cause more problems than you already have. So I will recommend that patients either get moisture goggles or tape their eyes shut when they go to bed. Now, put in the ointment before you do this and then tape it shut or put on those goggles. Either way, you need to protect your eye when you're sleeping. Now that we have a daily routine, you're protecting your eye at night, I'm gonna see you every 2 to 4 weeks, depending on severity. Normally, within the first 21 days, we will start to see a little bit of function come back. The quicker we get that function, the more likely you're going to regain full facial function. Now, I've seen patients that go as long as a year, some as early as 1 to 2 months, and they get their function back. Everyone varies. This can affect people of all ages, as early as 10 years old, as late as 80 years old. The median age is about 40. Moral of the story is it can affect each and every one of us, but my concern is protecting your eyes because I don't want you to have any permanent vision loss. The eye is not at risk because of the infection, the eye is at risk because of exposure to the environment. So these are the things that I want you to do. If you have Bell's palsy, make sure you call your eye doctor, get in and protect that eye at all costs. So I love talking about the eyes. I love giving you tips, tricks, and methods to have the best possible vision. If you like what I'm talking about, like, subscribe, ring that bell. We have new content coming out every week.